Hello, everyone. Welcome to today's virtual roundtable, Risk Management Considerations, Campus Housing, and Residence Life. We're pleased to offer this program in partnership with the University Risk Management Association, or URMIA, and the Society for College and University Planning, SCUP. My name is Holly Stapleton, and I'm the Chief of Staff at the Akuai Home Office. I'll also be serving as today's moderator. Before we get started, I want to plug some of the ongoing COVID-19 reopening resources that Akuai is offering, including virtual roundtables like this one, all of which are recorded and accessible on the Akuai YouTube channel. Our online community, which allows for real-time conversation between our members on reopening, resources, and everything in between, and our COVID-19 resource page, which we continue to update on an ongoing basis. Your membership dollars fund these resources and all of our efforts in this space, and we sincerely thank you for your support and for being here with us today and every day. Today we're joined by an outstanding panel of professionals who are highly engaged in today's topic, and all of whom served on the Akuai Future of Housing Work Group. But before we get started, I wanted to go over a few housekeeping points. All right, so these virtual roundtables are designed in conversation format as opposed to a traditional webinar. We see these programs as an opportunity for all to engage, connect, and really be an active part of the program, so please be ready and willing to offer your questions and insights along the way. So this is how you're going to do that. Throughout the program, you can submit your questions using the Q&A button, which you can find on your Zoom menu. Again, please feel free to submit these as we go. As you enter these questions and comments, please know that questions are viewable to all attendees and panelists. If a colleague submits a question that you would also like to be addressed, please be sure to upvote the question so that it is flagged for us to ask live. You'll notice there's also a chat function that is also available if you'd like to make a point or ask things of other attendees. Another function that you have available to you is the raised hand function, and I see that some of you have already discovered that, which is great. This would allow us to call on you to ask questions in real time. I'm going to ask now if you can see or hear us and everything's coming through okay, that you please raise your hand so that we know that everything's working on your end. Okay, lots of hands raised. That's great. So back to today's panel. To start, we're going to have each panelist introduce themselves, their background, the perspective they bring to the discussion, and then offer some opening remarks on the topic. These topics were identified based on areas that were pre-submitted by registrants. After each panelist goes through that process, we're going to move into general Q&A from the audience for the remainder of the program. To get us started, I'm going to ask Sandy to jump in. Sandy?
Unmute first. Hi, I'm Sandy Mitchell. I'm with MIT and I've been here about 7 years. The panel were kibitzing that most of us spent our anniversaries this year working from home, and most of us forgot about them because of that, so interestingly. So today I'm going to talk about what we owe to our students, both those that are on campus, those that won't be on campus, those that commute to campus, etc., including sort of Greek housing that may be owned by the university or not. And I'm going to put a little emphasis on mental health services, just because those are so big for all of us in higher ed. So, you know, I'm going to preface my comments that I totally understand that all schools are different. We're different sizes. We have different splits between domestic and international students that attend our schools. And we also have a difference in the resources, both financial and otherwise, that are available to us. And, you know, things that MIT may be doing may not be possible at other schools. And so I'm very sensitive to sort of that topic overall. So MIT in general, just a couple bullets on who we are. We are a research university, so 50% of our revenue is research-based, 10% comes from tuition and fees, and then the endowment puts a lot towards that as well. We are big in experiential learning, both internships, externships, lab work, and things of that nature. And we are split between 60-40 graduate and undergraduate, so we're more heavily weighed towards the graduate side than undergraduate, which is also different for a lot of schools. So last week, our president announced sort of what some of our plans are for the fall. And, you know, it's keeping with MIT's mission, making sure the entire MIT community remains safe in our teaching, in our research, and enabling students to stay on track with their studies. So how are we going to do this? So I'm going to talk about a couple different components and weigh in on certain things. So we announced undergraduate, 40% will be on campus this fall, and it's going to be seniors, which is different than how a lot of other schools approach that. And the reason for that was they felt that they had less flexibility in their schedules to stay on track to graduate. And so that is where the focus was for the fall. We expect the spring to be different, that the seniors won't be on campus and it will be juniors, sophomores, and freshmen. I knew I forgot someone in there. But we need to make sure we can do so safely, you know, and everything else. There will be another contingent in the fall of students that may need to be here because of safety issues, living conditions elsewhere, and that they need to be on campus. We, over the summer, probably had about 2,000 people that still remained on campus anyways. So most academics, like most schools, are going to be online anyways. But again, because we do a lot of lab work, we do a lot of design studios and things like that, those will be in person for those that are on campus. Only those that are living, and this is undergraduates, in MIT residences will be allowed on campus. Even if you live in Cambridge, a block away from MIT, if you are not in a residential dorm, you will not be able to get to MIT or any of its buildings. So it is a little different from our grad students because, like I said, 40% population in the undergraduate area, and that will be single source dorms like most people are doing. Our graduate will be at 85% capacity in our residences, and that is due because most of those are apartment style anyways, and so they're already social distancing in some respects. But a lot of our grad students also live off campus in the immediate area, and so there's a different track that we're taking between the two populations. You know, Cambridge is pretty conservative, and so mandatory mask wearing will be in place, no cooking in rooms will be in place, and a number of other things that may be different from other schools. And to combat some things like, because there's no cooking in dorms, we are going to subsidize meal plans by 40%. And doing some of that. There'll be regular testing of students as well as employees and things of that nature. So what have we done? And in the sense I said of commuters, we don't really have commuters except sort of the grad students because they may live off campus. And those policies are still being worked on, to be honest with you. A lot of them are already starting to come back on campus because there are researchers. They're the ones that are already coming back and started coming back in June. So we're still working on what those procedures will look like. My best guess, like I was telling Holly, I had to get tested today, you know, in order to keep being able to come back on campus. So I assume that it's going to be that. There'll be testing and random testing, and you have to do your daily attestation that you're feeling well and all of that. So I think those will be part of the policies we see in place for our grad students. So experiential learning, you know, we've got a lot of that going on. We do a lot of internships and externships. The summer for us is the biggest travel season, and so that was put on hold this year. But we have over 1,200 students that travel around the world doing internships. So two things that we're trying to do, both our EHS department, and I call them our makerspace czar, one of our professors, put together a whole flow chart of, you know, how to do sort of makerspace work at home. And it was sort of a red, yellow, green, orange thing that different policies and procedures had to be in place in order for you to get the approval to do certain projects at home or, you know, wherever you were living. And so that was rolled out probably about a month ago, trying to allow people to continue doing studies and projects that they had in place. Our big push on internships and externships, what they're trying to do now is in countries around the world, if they can do them remote from their home. Can you still sort of arrange those situations for students that they can do them? And in certain countries where COVID-19 may be under better control and that there is the ability to go to an office, is it safe to do so? And can we arrange those things as well for the students? So we don't call them necessarily fraternities, FSILGs. I always get that confused. Fraternities, sororities, and independent living groups. Those will be closed in the fall of 2020 like most people. The one thing that MIT is doing is they're trying to sort of work with the houses and things like that to provide some subsidized funding so to cover some of the operations that will still continue with the houses and things like that. nature. And I know that there's discussions because in the summer they make a lot of their money by renting out rooms, which they weren't able to do this year. Again, we've sort of talked about the commuter. We don't have a lot of commuters. So, for those that are commuter schools, I can't give you sort of a lot on that at this point. But mental health, I do want to focus my last couple minutes on that. Like anyone in higher ed, it's a big sort of focus. We were approached by MIT Medical, who has a team of mental health people on staff, saying, with telemedicine and our medical malpractice insurer was allowing them to do telemedicine around the United States, they were comfortable with that, but they weren't comfortable sort of providing those services internationally because they can't manage all the laws in all the countries that were out there. And they wanted to be able to provide the same services to our international students as those that were domestic. So we were able to pinpoint 630 students and where the countries that they went home to. So we, through our third-party vendor for sort of services when our students are traveling, we had purchased through them, through our regular course of our contract, counseling services for the students when they're traveling abroad. And through that, we were able to get introduced to the vendor that provides those services, and we have contracted with them directly that our students internationally will be able to access mental health services. They can get up to 8 sessions telephonically, however they want to do it. And if they need further services, this company will sort of help guide them to the right resources and where to get help and things like that nature. And that is actually rolling out on August 1st. So we're glad we were able to sort of get that in place. And, it keeps it consistent. We're trying to be as consistent as possible, whether you're on campus or off campus, sort of in what we're able to provide to you. And then, one thing that I learned through this, just my wrap-up notes, in talking to my emergency management person, something that they're rolling out, anyone that's coming back to campus has to have an emergency evacuation plan. She knows that a lot of schools that are in Florida that are prone to hurricanes and things like that have them, but we're asking students to be prepared. If you're asked to leave at a moment's notice again, how are you going to do that? And the last thing, the one thing that MIT is benefiting from, we're doing a lot of construction. And while it was delayed for a number of months here in the Boston area, we have 2 dorms that will be coming on. And so we're able to use that. We're holding off closing one dorm until January, and we're going to hold off demolishing another dorm until next spring to provide some swing space to house students if they get ill. We're leaving some rooms in their individual dorms, but not every dorm can be done that way. So we will have room to house people because some are going to get sick and we're aware of that. So we're trying to plan for that as well. So that's my main comments. I'm going to turn it over to Stacy.
Thanks, Sandy. So I'm Stacy Kroll, Director of Compliance and Risk Management for 5 Colleges Incorporated. For those that aren't familiar with 5 Colleges, we're primarily an academic consortium in Western Massachusetts. So both Sandy and I are coming from the Massachusetts lens, which I think we'll talk about why that's a little bit unique to the rest of the country at this point in time. So I actually am a shared administrator. We have a shared risk management department that serves Amherst, Hampshire, Mount Holyoke, and Smith College, and the consortium in and of itself. The 5th college in the academic consortium is University of Massachusetts Amherst, of which I do not provide risk consultation to them. So just the 4 private liberal arts colleges in Western Mass, and we are residential. So similar to Sandy, we are not allowing for commuters to come on campus. We are honoring our residential experience, and if we have not allotted capacity, then you will have to learn remotely. So today I'm going to talk about waivers and participation agreements. Waivers obviously has been a topic of conversation in the residential setting for the last few months. Colleges gear up towards reopening and allowing a residential experience. The liability is massive, and schools are worried about getting sued, frankly. And the fear is real, and there's not a lot of legal immunity afforded to us yet. Fingers crossed, there might be something in the future. But the big conversation has been around whether waivers can be a solution to that liability. And a waiver, for those who aren't familiar, a waiver is a state-specific protection. So you would have to know how and I'm not an attorney, by the way, but you would have to know how your state traditionally responds to waivers. Massachusetts is a very waiver-friendly state, so if you talk to any college or university risk manager in Massachusetts, we love our waivers. A properly constructed waiver is two parts. It includes an acknowledgement of risk, where you acknowledge risks associated with a particular activity, and then it includes a release where you agree not to sue the college. You assume the risks and you agree not to sue your institution for anything resulting from that activity. You know, we use waivers, like I said, at our schools all the time. Our waiver philosophy has always been to use it on voluntary activities, so that if there's anything that we are collecting revenue from the student or from an outside party and making a profit or making revenue off of, we have not asked to sign a waiver. It's our philosophy that if you're accepting fees, then you should be incorporating basically the cost of doing business. We should be assuming the risk of doing that business. Now, this can be complicated if you've received some bad news in this insurance environment that you have a COVID-19 or communicable disease exclusion on your liability policy, which is a little bit of wrench in your works if you were unfortunate enough to get that news. We were not. So we have insurance available, and we are likely going to proceed without incorporating a waiver. We will, however, incorporate that first part of the acknowledgement of the risk. So we will document the risks associated. We will be very explicit. We are not over-promising any of the residential experience. We are, again, very explicit about what this will look like, what the risks are of participating with us. We're going to partner that with a participation agreement, or some of them are calling it a social compact. Some of them are calling it an addendum to your student handbook. Whatever it is, it's all those rules and regulations around mask wearing, around social distancing, around limitations in spaces, around testing if you are mandating testing. Just like Sandy, in the state of Massachusetts, we received some industry guidance that we should be doing asymptomatic testing once every 3 to 5 days for every student and high exposure employee. So we too will be rolling out some form of that model where we will be mandating folks to be going to a predetermined location and be doing the swab, and we'll be monitoring those results. Interestingly enough, like I said, we've been having this conversation for a couple of months, and the question comes up of the, are you sure you don't want to roll out a waiver? Are we sure that this isn't the right thing to do? And I'll say in the last 3 weeks, two things have come to light. One is a law professor at University of Georgetown actually wrote an op-ed in the LA Times asking parents to be mindful that universities and colleges will try to put out waivers. And it was very, and we'll share the link in the chat, it was very strongly worded if you haven't seen it, as to basically the waiver is the enemy. And asking students and parents to affirmatively tell their institution that they are not releasing their rights, but in fact they are retaining their rights to hold colleges and universities responsible for the spread of COVID-19. So really interesting kind of twist. The other piece that came out in the last couple of weeks was NACUA, the National Association of Colleges and University Attorneys, developed a great resource in their NACUA notes of the legal analysis of the liability facing institutions, and dedicated 3 or 4 paragraphs towards waivers and how we should be considering them. So it's a little bit reaffirming for those of us that have been having this conversation similarly over the last few months, but that NACUA document basically articulates everything I said in legal terms. So yeah, I think that's what I have to say about waivers. And we're going to talk a little bit about enforceability of that participation agreement too. So I know that's a big question right now.
Thanks, Stacy. Let's move on to John.
Thanks, Ollie. Hello, everybody. John Lowry. I serve as Associate Vice President for Student Life at Colorado College. We are located in Colorado Springs, Colorado. We are a 4-year residential campus serving almost exclusively undergraduate students from all 50 states, about 10% international students, total enrollment right around 2,100. And as we began thinking about this year, we were expecting one of our largest first-year classes, of course, working to accommodate students who are unable to study abroad, and looking at reducing the density in our campus. So many different challenges as we were trying to manage the various risks of the spread of the virus. My role with ACUHO-I and the Future of Housing group has been to lead the risk management, liability, and communication subgroup. And through that work, we were constantly reminded of the fact that in many ways we've been managing risks throughout our entire careers as we work in student affairs and in higher education, and to lean on some of the ways that we've made these risk management decisions in the past in the current circumstance. And often what we're doing is weighing, trying to balance out the opportunities associated with taking some risks, whether that's outdoor education or things, weighing that against how much we might limit an activity to protect people's safety. In this context, many of us have been challenged with balancing taking financial risks that may serve ultimately to protect the institution's reputation. A clear example of this might be in terms of the college's willingness to invest substantially in testing practices that may do, in many ways, the best work in giving people confidence that the campus is going to be safe. At the same time, that does present across our spectrum of institutions some vast inequities. Not every institution is capable of taking some of those financial risks. A well-resourced institution is in a very different place than an institution that's really in survival mode in this time. So one of the most important things that we can do in this time is to say what we'll do and do what we'll say. And that's an important element as you consider your specific context, right? We're all working in different kinds of contextual environments, who our peer schools are, who our constituents are going to compare our plans with. And that's going to look very different, right, for a Colorado College environment that is dependent on the residential experience, on students being on campus and being able to interact with one another. That sets a very different expectation for students who may come to a college like ours than perhaps an institution that is serving 60,000 students, perhaps many of those 60,000 students already learning online. So context is important. We don't want to fall victim to groupthink, so-and-so did such and such, we're going to do that. We want to be able to work hard to communicate what it is that we're doing and to be able to answer the why, right? Because again, there may be very good reasons why an institution has more limited testing than an institution that may be in the same state, maybe even in the same county, but has a very different context. I think as we've thought about how best to mitigate risk, communication is our greatest asset. And communication is how you can work to shrink the gap between expectations and what is the probable reality of what life is going to look like on your campus, right? So that can be done in several different ways, right? Some of that language is important, right? What expectations are there developed around different words? We were talking about waivers, the difference between a waiver and a pledge, or an addendum to a housing contract. How people are describing what it is that you're doing, are they describing it consistently? And are we working hard as a college or university to be perceived as a singular institution? That demands that we're saying the same things, we're describing things in the same way. And that's a huge step in helping to not widen the gap between expectation and reality. Another key area around that is making sure that your definitions are consistently being communicated around an isolation space versus a quarantine space, or isolating in place or quarantining in place or in your home. If you're not able to speak uniformly as an institution, there's that potential to increase that gap between expectation and reality, and that could increase the liability that you face. We'll be talking more about this as we try to answer your questions, but in a lot of ways, this is going to be an exercise of our best decisions possible. An example might be, as you're trying to make certain that in your residential communities that people are confident that if you have a positive test, that you're able to clean and disinfect that space. At the same time, you may be challenged with the choice of saying, do we wait 72 hours to clean that space? Or do we send in a team in full PP&E to clean that space that might cause great anxiety among the student residents as they see those individuals coming down the hallway that they are standing in? They may have their mask on, but they may feel grossly unprepared for this risk that they perceive may be tremendously great based on what they're seeing. Yet if you wait 72 hours so your team won't have to be quite as suited up, if you will, what has happened in those 72 hours? What was the risk to that decision? And that's not something that's going to be easy, but it is something that whenever we're talking, I coach our emergency management team. And the one thing we tell people is that your greatest risk is not making decisions, right? Because that is then going to leave things unclear. And what you're trying to do is be as clear as you can in all these different circumstances. So looking forward to continuing to answer your questions, and I'll turn it over back to Holly.
Thank you, John. Chris.
Thank you, Holly, and thank you everyone for being here today, and thank you for oops. Sorry, as I was turning my timer on my phone, and so, but I wanted to first start by thanking everyone for participating in today's conversation, and also to the colleagues Sandra, Stacy, John, and especially Holly for all the work that's been done in our Future for Housing work group. And all the colleagues that are on this call and those that are not, that also participated in this heavy lift that's contributing to the profession. So as Holly was introducing me, I am the Director of Housing at American University located in Washington, D.C. And our campus is a fairly small, compact campus in a neighborhood off of downtown D.C., home to about 11.5 thousand undergraduate students with on-campus population of about 4,300 beds. And most of our residents are first and second year students with a little bit of juniors and seniors, and that is how we're going to be functioning this fall. We opted for the option of all singles across all of our buildings. And so that has reduced our student housing capacity significantly. We're going to be operating at about 50+ % on our main campus spaces, close to 60%. And we've also leased a few off-campus buildings, which is a reality that I know is there for some colleagues, especially here in Washington, D.C., and I'll talk a little bit about that in a minute. Our student population is one that's very engaged, very connected politically, the communication field, journalism, etc. And so one of our the concepts that we have in the back of our head is how will all of our students engage, the ones that come to campus, how will all of them engage during an election year, which American University, just like many of the other DC schools, and I imagine several of the schools that are here on this call, students, also other campus colleagues tend to be very connected politically, getting out there here in DC to participate civically, protests, conversations with other students. And so that's also part of our campus perspective and also some of our discussions and challenges as we work through identifying what fall semester could look like and what that structure could look like. Some of the aspects that I wanted to touch on relate to the concept of financial risk and a little bit about facilities, risks involving facilities. So the first one on financial is this concept that our occupancy, our fall semester occupancy is still fluid. For most universities in the United States, it is still fluid. The data points that we've used in the past are not all valid at this moment. We have many more variables in the formula that informs if a student is going to be coming back in person to the university, to this new housing scenario that we've developed, right? Most of our campuses, I believe all of our campuses have remote learning options, and so coming physically to campus not being a requirement. And so while some students have applied for housing, secured a space, you still have a chance that some of them may not come. And here in my university, we are seeing some of those aspects in the conversations that we have with students and families, in the webinars that we have, in the emails and chats. And so that part, that fluidity and possible variability on occupancy is a big financial risk. Some of us have gone and leased off-campus properties. A couple weeks ago, we had 3 buildings that we had leased, and now we just have 2 because we ended up not seeing the interest for students for that 3rd building. So we had to quickly make sure that we were not completing that project and moving forward with that one. Otherwise, we're going to be left with possibly an empty building, which is a significant financial impact. And so all the way from that perspective of a large financial risk to connecting and understanding these new variable points, I think it's an important piece for us to keep in mind. International students, very unfortunate situation with policies that are impacting international students right now. Will new ones come from abroad? Will some that are here leave? And what does that mean to reservations that you have right now? Is that a small impact? Is that a large impact? And are you aware of that? Are you connecting with your campus's enrollment task force to understand how the students that are assigned beds are coming to campus or not? Are there other indicators that you can look and verify that they may help confirm or support your occupancy or not? And I think one aspect that connecting with what John said about this aspect of communications, I think from what I have learned, and would love to talk a little bit more about that, is the internal communication aspect based on what we can achieve financially and what are doubts that we have. COVID-19 has caused all of us to be having to do a lot more and different work that we were doing before. While we're trying to stay connected, there's also, there's a lot of people doing their own work and also being disconnected in different ways. And so being congruent in our communications internally, making sure that we share the doubts that we have, we share any concerns that we have, so that 3 weeks from now, if a few dozen students don't come to campus, what is that impact financially in a year where every penny counts, right? Every cent counts. for the operations of the university. So, and then a few more pieces related to this concept of risk financially and facilities. We've made tremendous commitments to our students, more, added safety, added barriers, added elements. We've purchased, we've modified buildings. We do have to make sure that we stay focused, that we have this, this time frame, whether this is 6 months, a year and a half. But at some point in time, there will likely be a change or an adjustment, which may be focused with the next school year and the next recruiting class. So what would that look like at the end of the school year? And are we prepared? Are we thinking about what that looks like at the end of that? So we have to start not just thinking about the beginning of fall, but also how are we going to tie in the continuation of the next year, so that we're not losing resources. We're, all the way to all these, plexiglass barriers. If one day we're going to need to store them, where are we going to put them, right? So there's a connection of process that we have to be thinking about that impacts us, that is related to risk. And lastly, something that we started talking about in a call with some other colleagues is, if everything moves as many of us are discussing, or in the scientists and experts share that a possibility of a vaccine is in the horizon for this next year, we may be looking for a very large fall class next year. What does that look like for us as we prepare for that? And that we make sure that we don't lose sight of that will impact our enrollment, that will impact our housing capacity, that will impact us financially a year from now. So I'm continue to be interested in discussing it and in sharing more of these concepts and some of the ways that we've been thinking about here to prepare not just for the now, but also for the after. So thank you.
Thank you, Chris. So I want to dig in a little bit to enforceability, because that's a topic, Stacy, you mentioned it. It was kind of a hot topic in the pre-registration questions, and it's also showed up in the Q&A a few times since we started the roundtable. As Chris mentioned, schools have made plans, in some cases publicly. Some have changed them. It's very possible some will continue to change and there'll be multiple iterations. And we don't necessarily know where people are going to end up, once we reopen. And so one thing that many practitioners remain a bit unclear about with regards to mitigation strategies is, how do we enforce these things? How should we enforce these things? And how can we enforce these things? For those who spend time in the Twitterverse, there was a very popular thread by a faculty member in Connecticut. I don't remember her name, but she's talked about a poll that she did. It was actually, I think she did focus groups with students about different elements of mitigation strategies and how impactful the students thought they'd actually be if they were implemented on campus. And the short answer is not so great. And so my question for the panel is a couple things. First, from your perspectives and observations, how might we enforce these things with students? What might the consequences be if they do not comply? And what are the limitations legally in terms of if they don't, right? So we're going to be asking students to, in many cases, engage in things like mandated testing, temperature checks, mask wearing, social distancing, a number of other types of mitigation strategies. How far can we go in terms of what we're asking students? I want to start with you, Stacy, if we can.
Yeah, so we can ask them to do a whole lot. We can mandate that they do all these things if they're residential students. The question has come up about for those schools who are allowing commuter students, or schools that are have community apartment or leasing agreements with local property managers, and this is the traditional housing model for some of your students, whether or not you can enforce those kids. And I don't know the answer, because that's not in my universe. So I know that we can ask our residential students to do a whole lot. Yeah, Corona parties are going to happen. Protests are going to happen. It's, we're in an election year, we're in a civil rights movement. Our students are going to weigh You know, even if they're doing the best they can to comply, they're going to weigh, you know, should I be following this mandate or should I be, you know, participating in a civil rights movement? And I think, particularly for our students, I think our kids are going to be marching in November when these things come up. So how do we pick and choose which battle? And we've talked about a radius around some of our campuses. So one thing we did in the spring and we'll continue in the fall is nobody can leave. Students cannot leave more than 10-mile radius from your campus. And my 4 schools are a little bit mixed. So one of them is a more urban campus, Smith College in downtown Northampton. Everything is in walking distance. Hampshire College is a much more rural campus and we have to take a bus to get to, you know, the local Stop and Shop, local grocery store. So it varies based on campus, but we've even talked about limiting their movement in the region. The sanction that we're throwing on that for the participation agreement is going to be removal from your residential experience. Now, one thing that troubles me is in the spring, as we all found out, there's a number of reasons why we cannot just blanketly remove a residential experience from a student. Sandy, you said 2,000 people. I had at least a couple hundred on every single one of my campuses, and we only have an enrollment of 1,600 at the largest one. So the fact that there were 200, 300 students who couldn't get home or were, the college was their place of, you know, permanent address, that means that if they're the ones that aren't complying, we can't pull them. So what does that community pushback look like? And does it look like we're using the rules fairly? And what support can we offer our, you know, Holly, you had mentioned the age demographic of the people that are going to be responding to this are our student RAs. They're going to be, you know, SEAs is what we call them at Mount Holyoke. So how do we support them to do that intervention, that peer intervention and peer support? And it is going to be messy. Check with your legal counsel about what you can enforce. We are going to try to enforce every single piece of our strategy that we can. What that looks like in September when everybody comes back, we're just hoping that our school profile is not conducive to COVID parties where, you know, I assume everyone in higher ed has heard about these, but they're group settings where you pay a pot and the first one to get COVID gets the pot. So it's a scary thing that's happening on our beaches this summer with college age kids. So, you know, I mean, yeah, best of luck. I wish I had an answer of how to do it right, but all I have is more questions and sleepless nights.
Thanks, Stacy. So I want to jump off of something that Stacy mentioned. So as we think about this concept of enforcement and specifically in residential spaces, there's this added layer that a certain class, I'm going to use that term even though that's not the right term, professionals are going to be at the top of the list of enforcers, right? So you have resident assistants who are typically undergraduate students. You have live-in staff who are typically younger in career trajectory, at least, right? Less experienced typically. You know, what concerns do you all have about these risks from a health perspective for these community members who will be, you know, conceivably confronting community members who are non-compliant? Maybe we can have John and Chris kind of start that off.
It's an important question. I think too, going back to the importance of language, I think it is going to matter on your campus, whether you're trying to enforce policy, whether you're trying to hold people to a pledge, or whether you're just asking staff and students and faculty and staff to follow a protocol. With policy does increase the expectation that there will be consequences to violators. But I think particularly as you're thinking about public health, you do need to think about, are those consequences going to be equitably enforced, not just in your residential communities, but on the campus as a whole? Will faculty and staff and contractors or others on the campus be held to the same standard? Because failing to do that will no doubt create tremendous equity concerns that will be voiced and will further complicate your ability to kind of keep the focus on public health and keep the focus on the health and well-being of our students in those communities. Like anything that we're doing with our paraprofessional staff, they need to understand their boundaries, right? At some level, they will be expected to make a confrontation, and then at some level, they'll be expected to take that confrontation to another entity, right? They should not be under the disillusionment that somehow they are going to be the ones to make it happen. But they could certainly find resolution through the relationships that they have, right? Somebody who may be walking down the hall without a mask on, who's approached by a peer resident advisor in a way that we would approach lots of things, right? Alcohol, other kinds of things, in that initial interaction and training staff to say, hey, you know, you're supposed to be wearing your mask. Did you forget? Did, you know, and then obviously if it's an individual who's known to be non-compliant, that already might escalate it to getting someone else involved. But our resident advisors and our residence hall staff, what they demand and what they expect most from the institution is that they're not the only ones doing this, right? So if they begin to understand that no one else on the campus outside the residential environments is doing anything to enforce these policies, then we have to be careful in terms of what we expect of those staff. I've heard lots of references to comparing this to, say, a campus smoking policy or various kinds of things. Everything's very complicated, but I do think that our obligation is to make sure that in training, those boundaries and the limitations and when to turn it over to someone else, obviously you have to identify for them then who that someone else is. And going back to my other comment about doing your very best to keep the gap between expectations and expected reality as small as possible, but acknowledging that there will be a gap. And that if an individual expects that no one ever will be without a mask, I think that's an unrealistic expectation. I think we have to be working towards figuring out how we help our communities understand that there's going to be those conflicts that we're going to need to navigate, and then what else can we do to avoid an escalation around something completely different. And that's why I think that equity piece is so important for us to be considering as we're setting forth those expectations as staff enforcement.
And if I could, and John, thank you. I think you put it perfectly. I would just add that for the staff that are on the front lines and communicating and engaging, you know, holding accountable others. Certainly 100% agree with what John said, that should be a campus-wide effort, and that what is happening in the classrooms with faculty members, that is also what's happening in the residence halls. That is something that I think that student housing colleagues want this to always happen, it's incredibly important, I think, as well to make sure that as these expectations are discussed, that these are reflected in contracts, that these are reflected in requirements, and that these have been discussed with human resources, that have been discussed with legal team. I know in our campus, there's conversations happening right now about that. But there needs to be a documented processes, not just in the Housing Residence Life training manual for the student staff, but also in the contractual agreements, that this is now part of the requirement. I think one of the first webinars we had in the Future of Housing series was about this, about human resources and the expectations that, you know, work and jobs would change, and they may change, right, in universities due to COVID-19. I think it's incredibly important that we maintain the transparency and the expectation that what is a job requirement, and that something doesn't just come and people feel that they've been caught off guard, that was going to be something that they needed to do. So I think that is incredibly important. And I fully agree that the more communication we do, the more community support we do, community-based social marketing, involvement of families in the education of students. I think the less cases of the less situations we'll have to do that will be in this level that we're talking about. So.
Great, thanks, Chris. So I want to switch gears really quick here. You know, in the pre-registration questions, we had several questions around quarantine and isolation space. And specifically, you know, over time, certainly at Kauai, we've getting a lot of questions around, you know, how do we decide how much we set aside? How do we identify what we set aside? I want to shift that question for this group and towards, you know, how are we going to accommodate some of those things that have to happen in those spaces? And specifically around things like meal delivery, medication delivery, mental health checks, et cetera. Those things that are really critical for folks that are moved into those types of spaces to have a good experience and hopefully get well and better and move back to the normal population, if you will.
So Holly, I can comment on that. So we, where possible, we are trying to leave rooms open in dorms so that they don't have to leave their specific dorm. And I think that's in situations where there's a separate bathroom and that they can sort of isolate safely within that dorm. But we can't always do that. And so we had a dorm, and I think I shared this in the chat, we had a dorm that was due to come offline at the end of this past year that we're keeping open until January. And that was where we will house people that may be ill. And then that actually has to go offline in January to be refurbished. And we have another one, a grad dorm that was delayed, but it's coming on, the new one's coming online in November. So the old one was due to be demolished, and we're delaying that so that we could use that as the swing space in the spring. So we're trying to do it safely. You know, various people will help manage sort of the food delivery as well as medication, and the mental health services would still be available. So there's a number of different things going on, all the moving pieces, and trying to do it so it's the least disruptive both to the student that is ill, but to those that are around them at the same time. And I want to point out, if people didn't notice in the chat, that Jenny Whittington shared sort of some news that came in about the international students. So good news there.
Thanks, Sandy. So really quick to John and Chris, I want to ask, what are you hearing in your networks about, from a staffing perspective, how those things are getting accomplished? I know that a lot of housing folks are nervous that these types of tasks and roles will be loaded heavily on live-in professionals in particular. What are you seeing and what are you hearing from colleagues on what that's going to look like in the fall?
One of the aspects that I've heard is the intention to try and make processes as simple and seamless and electronic as possible to reduce the amount of staff involved in, let's say, all the way from when the student is being considered and being tested, all the way to if they're tested positive and they are in a room and receiving support and being in recovery. So that in our conversations here on campus, as well as with colleagues in other networks, that was the idea, is to make sure that we think of the whole process from A through Z and see how many people are involved. You know, if we did it in the spring semester, can we clean up that process? Can we make it simpler? I think that's really one component. We even talked about here for us, because all of our doors use an access card, how can we make that, you know, a really quick process where somebody just gives access and it's in the same card, that we don't have to give an extra card to someone, right? So that's, I think, the first one. The second one, I've heard a few different pieces of having university staff, housing residence life staff, and dining staff connected, jointly support the students, right? One is providing a check-in and the other one connecting with food. But I've also heard a third option is hiring third-party medical staff, not full MDs or DOs, but you know, nursing staff or a staff that is connected with a health support system to be the point people to connect with those individuals in person and to live in the building. So I've seen different options, and actually that is based on a university and their perception of how they want to be involved in this. The food element tends to be, I would say, a critical logistics, as we know, but it's also one of the most discussion and dialogue about. Some dining services want to be, are okay coming in and delivering food to the door of a student that's in isolation or quarantine. Some others don't, they want someone else to come and pick up the food from the dining hall to take it over to the student's space. And so I've seen both ways, and certainly there's not a right or wrong aspect. I think there's a perception of and focus on how we're going to do this. How can we do this with the least amount of people possible and in the best way possible? That is the most efficient in the safest way. I know different food management companies, the large ones, have even put out perspectives on this and notes on will they engage in this, will they not? You know, they'll prepare a box lunch and it'll be ready here, but somebody else had to come and pick it up. So the logistics, they're still concerned about who is going to do it and how they're going to bring the food. And then the last part, across all of these elements, the concern for the health and safety of cleaning, as well as removing waste from a room that has had a student that is positive. That I know that perspective has not changed. It still remains with a specialized company focused on health, waste, biohazard waste removal. That seems to be across multiple universities. That has been a perspective that I've seen colleagues talk about, that they agree on, that is one that you should get a third-party company, a specialized company involved in completing that. So I think there's different aspects to the whole process. People are, depending on the school size and the school type, addressing it a little bit differently. But I do think that main concept of trying to make the process as clear as possible and as streamlined from beginning to end is what colleagues are talking about.
John, anything to add to that? I saw some head nodding.
Yeah, the only thing I would add, many of us do rely on 24/7 entities on your campus. And so I know that our campus safety team has been amazing and outstanding in supporting students during this time. And they'll also be a part of our plans to support students in isolation and quarantine.
Thanks, John. Well, somehow it's 1 till. So really quickly, I want to go through a couple things before I have our panelists do some final thoughts. The first thing is a lot of what Chris and John in particular spoke about, and certainly Stacy and Sandy as well, appeared in our COVID-19 considerations for practice document, which was kind of the culminating piece from the Future of Housing work group. The group also created a number of checklists to make sure that senior housing officers in particular, as well as risk managers, had the important things top of mind. We also have a next term campus housing plan tracker, which allows folks to enter their information, what their plan is for occupancy, what kind of rooms they'll be using, along with a number of other variables of interest to folks, including isolation and quarantine space. All of these are public facing, so anyone from any organization can see those things, and we will share that link out. I also wanted to point out that our partners are doing great work in this space as well, obviously. URMIA has a number of online resources and updates, as well as a number of events coming up related to COVID-19 practice. SCUP as well has resources around planning and response. So as we kind of wrap up here, I wanted to give our panelists 30 seconds each to kind of give their final thoughts on this very, very large topic, so that we walk away with something to think about. And how about we start with Sandy?
Oh, sure. I don't know if I have any sort of wise, comments to share. I think about Disney World that just reopened this week or something, and wasn't there a ride called Mr. Toad's Wild Ride or something? And I think we're all going to be on it this fall. So that's my comments.
Sandy knows I love Disney too, so that hit a little close. Yeah, it's going to be, I mean, it's a great time to be a risk manager. As a colleague said once, like, this is the piece of the story that everybody wants a part of. They want to know what higher ed's going to do. And congratulations, all of us are at the center of it. But, you know, at the same time, if for Hunger Game fans, may the odds be in your favor, because it's not going to be smooth sailing. It's going to be a rough ride.
Yeah, I would just continue to go back to doing your very best to shrink that gap between expectation and reality. Be clear as you can on what you expect from your students, from your faculty, from your staff. Because if you're not clear what you expect of them, you can expect others to then place that expectation on your institution.
There's so many resources out there. There's so many people doing great work out there. Use the resources that are online. Use the different tools that are created. You know, we're putting a lot of energy into creating new things when sometimes we have a lot of nuggets of information already out there. So I would say encourage you, look at those before you go out on a route of creating something brand new. There's a lot of information out there. Thank you.
Great. A big thank you to our panelists, and thank you to everyone in the audience for joining us today. On behalf of ACUI and our partners, ERMI and SCUP, thank you, and we look forward to seeing you soon in our respective virtual spaces. Take good care.